Welcome to Digital Health Live. My name is Tim Ria. We're here down at the Digital Summer Summit 2014 in San Francisco. My guest is Kimberly Petty, who's the Managing Director of Experience Innovation Network, part of Vocera. How are you doing?
I'm doing well, thanks.
So, welcome to the show. Always excited to meet new people. And so the topic here was cultivating high-impact results, the human equation. What was going on inside, but I also want to start out with who are you and what's your background?
So they announced at the beginning I'm a recovering Lean Six Sigma Master Black Belt, which means I spent about 10 years at GE focused on improving efficiencies, and I have since learned that if you focus exclusively on efficiency, you lose sight of the empathy factor and the human equation. So hence my position in facilitating this panel. And my day-to-day work is actually, we're part of Vocera, but we're a part that does the thought leadership and identification of what are going to be the next leading process and technology innovations that improve human connection and clinical outcomes in healthcare. So,
I'm hearing a lot of trends. It's not about the technology, it's about the high touch at the end of the day for the end consumer of all this.
Exactly. So what our research looks at is how the communication and human interactions that are layered with technology actually improve patient adherence, clinical outcomes, reduce readmissions, improve patient satisfaction, all of the different outcomes that hospitals and health systems are looking at today. So that's we have a group of health systems in the US and Canada that come to us to help them filter through the proliferation of everything that's in the market and help them identify where are my best bets and where do I make my investments in healthcare technology and process innovations, given everything that's out there that's going to have the biggest ROI.
So what were some of the panel topics and what were the hot points?
Yeah, so had MD Revolution and Be Close on the panel. Samir and Mark, great speakers, both have excellent technologies that they're bringing out that they're not relying exclusively on that technology to solve for the problem. They're realizing that you still need to have a human being in there to digest the data. I mean, as we look at things like the self-tracking movement, people are really quickly abandoning that because there's nobody there to hold them accountable or help them to digest all of that information and data. So I think what MD Revolution and Be Close are doing is really interesting in sort of pairing that so that there's some human intelligence behind the solution.
Yeah, it seems like people try to create business models with just the technology behind it. There's no human high touch and also assimilating that data in a human way.
Exactly. So with Vocera, actually, it's interesting what we've watched is there's a ton of process innovations that are coming out to improve patient experience and reduce readmissions, and it's the flip side of that equation, right? So they're doing it with process and not complementing with technology. So we've developed the Vocera Care Experience platform where how do you deliver just-in-time communications for patients for scheduled procedures? So you reduce length of stay, cost of care, improve clinical outcomes, patient experience, and likewise on the back end, how do you get them their discharge instructions in a meaningful way so that they don't have avoidable readmissions back into the hospital or health system?
Anything else that was really sizzling on the panel?
Really sizzling on the panel. I actually loved Mark's final comment, which was about getting your engineers out there in the field to see the interactions. I think all too seldom we hold our engineers in cubes or in like little farms as opposed to actually letting them see how people use the product and the device. And I love there's some projects out there like the Nurse Maker project. I don't know if anybody is familiar with that, where Robert Wood Johnson Foundation is doing ethnographic research on what are all the workarounds that nurses do so that they can perform their job, and then they're saying, how do we automate this with technology? I think the more of that type of activity that goes on amongst engineers, the better we're going to be able to serve and respond to both the people who have to, in their professions, who have to use the technology, as well as the patients and families who need it to support them in healing.
Okay. So what's next for you and how do people connect?
So you can find Vocera at vocera.com. You can find me at Kimmy, Kimmie, Petty, on Twitter. And I would love to hear specifically from people who are bringing innovations to market that we can help bring forward to the group of 35 plus health systems across the country that we convene and put together to help them discover where they can go next and what's going to be the next big innovation for them to adopt.
Awesome. Well, hey, thanks, Kimberly, for being on the show. Cheers.
Glad to have it.